Hey everybody, it's me, Cindy Berger, with my journey. Tonight's topic is nicotine addiction. So we're going to talk about nicotine dependence, some resources to give you if you're looking to quit smoking. Um, she still can't get in, so I don't know what the issue is. I don't know what to tell her. I have no way to help her. I tried everything I could last time. So anyway, on your photo in my journey. Yeah, nobody cares. See, like my phone is fucking talking to me and everything. It's really annoying. Um, I'm gonna have to throw it over there so it doesn't bother me. So anyway, we're going to be talking about the dependence and the symptoms, when to see a doctor, the causes. I'm going to show you a video or two, um, and then I'm going to give you some resources like the CDC website, the Mayo Clinic, etc. Um, so I'm just going to start with the nicotine dependence and give you like an overview. Um, so nicotine dependence occurs when we need nicotine and we can't stop using it. So the reason why I'm trying to delve into other addictions is because a lot of times when we stop drinking or using substances, a lot of times, not always, but there can be times where we change addictions to something else like food, sex, shopping, or nicotine. And nicotine is something that I still struggle with. So I wanted to get into that. And I am trying to quit smoking. I'm down to like 3 cigarettes a day from down from a pack and a half. So I'm almost there. So I just wanted to share my information with you and all my all my information I'm getting from the Mayo Clinic and the CDC. So this is all like actual information that's true and correct. I would never share anything with you that wasn't. So anyway, nicotine dependence occurs when we need nicotine and we can't stop using it. So nicotine is the chemical that's in the tobacco that makes it hard to quit. So nicotine will produce pleasing effects in our brain, but these effects are temporary, so that makes us reach for another cigarette. And the more we smoke, the more nicotine we need to make us feel good. So when we try to stop, most of the time we experience unpleasant mental and physical changes. And now these symptoms are nicotine withdrawal. So regardless of how long you've smoked, stopping can improve your health. It isn't easy, but we can break our dependence on nicotine. It's just like any other addiction. But I find that nicotine is the hardest addiction for me anyway. I think Shotzi's here finally. Yay! It freaking worked! Yay! Okay, so I was just going over an overview. I explained what nicotine dependence is, and what withdrawal is. So we're going to go through the symptoms. Um, for some people, using any amount of tobacco can quickly lead to a nicotine habit. So signs that you may be addicted include the most obvious one, you can't stop smoking. So you've made one or more serious but unsuccessful attempts to stop. Um, Another symptom is you have withdrawal symptoms when you try to stop. So your attempts at stopping have caused physical and mood related symptoms like strong cravings, anxiety, irritability, restlessness, difficulty concentrating. You can get into a depressed mood. You can be easily frustrated and quick to anger. It even increases your hunger, problems sleeping, and it can even cause constipation or diarrhea. It just depends on your body chemistry. Another symptom is you keep smoking despite your health problems. Um, I can use myself as an example. I've had blood clots in my lungs before. I have a clot in my leg now, and I'm stupid for even smoking, but it is what it is. And like I said, I'm trying to quit. I'm down to like between 1 and 3 cigarettes a day. It just depends on the day and my activities that I'm doing or how I feel. Another symptom is you actually give up on social activities. So, like, you may stop going to smoke free restaurants, or you might stop socializing with your friends or family because you can't smoke in those situations. So, when to see a doctor? Um, Obviously, you're not alone if you tried to stop smoking but haven't been able to stop. Most smokers make many attempts to stop smoking before they actually um, get to like a long-term abstinence from smoking. So you're more likely to stop for good if you follow a treatment plan. So a treatment plan is, in my opinion, better if it focuses on the physical and mental aspects of your nicotine dependence. So, and I will put a disclaimer. You guys already know this, but for people watching, what's good for one is not always good for another. So just take this information how you will, or how it fits into your personal life and your body. So, like I was saying, a treatment plan is usually the best way to stop for good, and that can include using medications and working with a counselor that is specially trained to help people stop smoking. So you want to, if you're searching for a specialist, you want to look up a tobacco treatment specialist. So that will definitely boost your chances of being able to quit. Um, you can also ask your doctor, your primary care physician, to come up with a treatment plan that works for you, or they can let you know, um, where else you can go that can help you to stop smoking. Um, Now we're going to talk about the causes. Nicotine, like I was saying earlier, is the chemical in tobacco that keeps you smoking. So nicotine reaches the brain within seconds of taking the very first puff. So in our brain, nicotine increases the release of brain chemicals called neurotransmitters. And if you guys have been in our meetings before, so you know what neurotransmitters are. It reacts the same way as other substances do. It causes you to feel pleasure, improved mood, maybe sometimes euphoria. And the more you smoke, the more nicotine you need to make you feel good. But and then nicotine quickly becomes a part of your daily routine, and it can become a habit. So common situations that trigger the urge to smoke include, some of them for me, I'm using myself as an example, drinking coffee or taking breaks at work, talking on the phone, driving your car, spending time with friends. And since I don't drink, I can't use this as an example for myself, but other examples include drinking alcohol. A lot of times when someone is out at a bar somewhere, it makes them want to smoke, even if they're not a smoker. So, to overcome the nicotine dependence, you need to become aware of the triggers and make a plan for dealing with them. So, those things that I just mentioned, like driving your car, drinking alcohol, talking on the phone, those can be your triggers. So figure out what your triggers are and try to avoid them as best as you can. And then next, I want to talk about risk factors. So anyone who smokes or uses other forms of tobacco is at risk at becoming dependent, obviously, and factors that influence who will use tobacco include your age, genetics, parents and peers, depression or other mental illnesses, and substance use. So, for age, most people begin smoking during childhood or teen years. I know I did. I was 12 years old. Actually, I was 8 years old when I picked up my first cigarette, didn't like it, and then I was 12 years old and I started smoking on and off, and then it became a habit. So the younger you are when you begin smoking, the greater the chance is that you'll become addicted. And that was true for me. So genetics, the likelihood that you'll start smoking and keep smoking may be partly inherited. Genetic factors may influence how the receptors in your brain, um, it may influence how these receptors on the surface of our brain's nerve cells respond to high doses of nicotine. So another thing that can influence is parents and peers. So kids that grow up with parents who smoke are way more likely to become smokers themselves. Children with friends who smoke are also more likely to try it. Another cause is depression or other mental illnesses. And so many studies have shown that um, the association between depression and smoking, there's a big association between depression and smoking. So people who have depression, schizophrenia, PTSD, or other forms of mental illness are more likely to be smokers. And then the last cause is substance use. So people who abuse alcohol and illegal drugs are more than likely to be smokers. So we talked about the risks. We talked about the overview, the dependence, and all that. So the next thing I want to talk about is complications. Complications from smoking. Uh, According to the Mayo Clinic, tobacco smoke contains more than 60 known cancer-causing chemicals and thousands of other harmful substances. Even the quote, all natural or herbal cigarettes have harmful chemicals. So you already know that people who smoke cigarettes are much likely to develop and die of certain diseases than people who don't smoke, but you may not realize just how many different health problems smoking actually causes. So let's go over those quick. Lung cancer and lung disease. So smoking is the leading cause of lung cancer deaths, and also smoking causes lung diseases such as emphysema and also chronic bronchitis. Smoking also makes people with asthma a lot worse. It can cause other cancers like cancers of the mouth, throat, the esophagus, the larynx, the bladder, pancreas, kidney, cervix, and some types of leukemia. So overall, smoking causes 30% of all cancer deaths. Another complications include heart and circulatory system problems. When you smoke, you increase your risk of dying of a heart and blood vessel disease, aka cardiovascular. Those include heart attacks and strokes. So if you have heart or blood vessel disease, such as heart failure, smoking will worsen your condition. Another complication is diabetes. So smoking increases insulin resistance, which can set the stage for type 2 diabetes. So if you have diabetes, smoking can actually speed the progress of these complications like kidney disease and eye problems. So speaking of eye problems, smoking can increase your risk of serious eye problems like cataracts and loss of eyesight. It can also cause infertility and impotence. Smoking increases the risk of reduced fertility in women and the risk of impotence in men. If you smoke during pregnancy, they face a higher risk of preterm delivery and giving birth to lower weight babies. It can also cause cold, flu, and other illnesses like respiratory infections, colds, flu, and bronchitis. And last but not least, tooth and gum disease. So, smoking is associated with an increased risk of developing inflammation of the gum and the gums and serious gum infections that can destroy the support system for teeth, which is also known as periodontitis, which is why I don't have any. Quick story if you don't know. Like I said, I've been smoking since I'm 12. I had a car accident where I had a really bad abscess because a tooth got stuck in the upper, like near my nasal cavity, and they couldn't remove it. They had to wait for it to come down on its own. In the meantime, I got a really bad abscess, and
She
I was
just shit
on
in the hot
antibiotics
water.
for months, for months. I can't even tell you how long I was on antibiotics for, to the point where they stopped working. Um, and then I developed periodontitis, which is why I don't
Maybe
have.
she got a drink.
So,
Oh, okay.
so what we can do to prevent things is the best way to prevent nicotine dependence is to not use tobacco in the first place. And I know that's easier said than done. Um, the best way to keep children from smoking is to not smoke yourself, or at least don't smoke around them. Research has shown that children whose parents do not smoke, or who successfully quit smoking, are much less likely to take up smoking themselves. So I'm going to put a post up in the group, um, from the Mayo Clinic, which is where I got all my information from, and there are experience and patient stories that you can read if you'd like. Um, so I thought that was cool. I'm also going to show a little video of someone's opinion a little bit. So diagnosis and treatment. Um, your doctor might ask you to fill out a questionnaire to see how dependent you are on nicotine. Like they'll want to know how long you've been smoking, how much, and all that, so they can determine the right treatment plan for you. So the more cigarettes you smoke each day, and the sooner you smoke after awakening, like getting up during in the day, the more dependent you are. I know myself, I will take my dog out right after getting up, and I'll smoke. So treatment, like most smokers, you've probably made at least one serious attempt to stop, but it's rare to stop smoking on your first attempt, especially if you try to do it without help. You are much more likely to be able to stop smoking if you use medications and counseling,
Destiny.
which have been proven effective, especially in combination. I'm trying to mute you, honey, so it doesn't record over my talking. Um, so and I will repeat my disclaimer from earlier. What's good for one may not be good for another. So like I said, take that however you will, however it works for you. Uh, because medications and counseling don't work for everybody, just like with any other addiction. So the medications, I'll talk a little bit about. Some quit smoking products are known as, quote, nicotine replacement therapy because they contain a little bit of nicotine. So some of these nicotine replacement therapies, um, require a prescription, but some others don't. So there are two approved quit smoking medications that do not contain nicotine, and both are available only by prescription. And any of these products can help reduce nicotine cravings and withdrawal symptoms, making it more likely for us to stop smoking for good. And using more than one may help us get better results. Although you can buy some, quit smoking products without a prescription, it's a good idea to talk to your doctor first so you can explore which products might be right for you, when to start taking them, and the possible side effects. And counseling. So the medications will help us cope by reducing our withdrawal symptoms and cravings, while behavioral treatments like counseling will help us develop skills that we need to give up the tobacco for good. So the more time you spend with a counselor, the better your treatment results will be. And some of these some of these counseling, like it looks like individual or group counseling, whatever you prefer, they're going to teach you techniques you can use to help you stop smoking. You can go to many hospitals. Um, you can check with your healthcare plan. Um, like I said, your healthcare provider, even like your employers may offer some treatment programs. Some medical centers provide residential treatment programs, which is the most intensive treatment available. So there's also methods to avoid. Um, that would be basically trading one thing for another, like electronic cigarettes. They have not proved to be safe, nor are they more effective in helping people stop smoking versus nicotine replacement medications. So people who use e-cigarettes to stop smoking find themselves using both products rather than just quitting. So it's really not a good idea to substitute another type of tobacco if you're trying to quit smoking. I've tried that route before, so I can definitely say it didn't work for me. Tobacco in any form is not safe, so you want to steer clear of the following products. Um, Dissolvable tobacco products, smokeless tobacco, um, the nicotine lollipops, and like the balms, like the balms as in like lotions almost, cigars and pipes and hookahs. So let's see. Coping and support. Like I said, I will put up some resources and things that I use for today. There are support groups. So oftentimes they are available at little or no cost at all. Support groups will offer you coaching and support from other attempts to quit, from our attempts to quit. Nicotine Anonymous groups are available in many locations. So you can also do telephone counseling. I will put the phone number on that post, but it is 1-800-QUIT-NOW, and you can connect directly to your state's quit line. There's also text messaging and mobile apps. A number of services are available to get like give you reminders and tips delivered straight to your phone. There are web-based programs like Become an X, which provides personalized support, interactive guides and tools, and discussion groups to help you quit. Sorry, I'm getting a massage while I'm freaking doing this. I have a thing on my chair that it helps my anxiety while I'm doing these meetings. So anyway, what you want to do if you do decide to see your primary care doctor, there's some quick tips and information to help you get ready and like what to expect from your doctor. So to get ready for your appointment, you can consider your smoking triggers, like I discussed earlier. I gave you a couple examples. You want to list the most, like the circumstances when you're most likely to reach for a cigarette, and in what situations has smoking become a ritual, like after dinner or driving your car. You want to make note of any symptoms that may be related to smoking, so you can include the length of time you've had each one. You also, your doctor should already have this, but I always recommend to make a list of your medications if you're going for any type of treatment. You want to have that on hand, and you want to include any vitamins or supplements too. You can even invite a family member or a friend along. Sometimes it can be difficult to, because they throw a lot of information at you, and I don't want to say that to scare you, but a lot of information is provided to you, excuse me, during these appointments. So you may feel more comfortable to bring a friend or family member along. Now, what to expect from your doctor? So you want to be ready to answer questions that the doctor may ask, like how many cigarettes do you smoke each day? How soon after waking do you smoke? Have you previously tried to stop smoking? And if so, what happened? They probably will ask what worked and what didn't work. They will probably ask you what is motivating you to stop smoking now, like what's your reason? They're going to ask you your physical health problems like heart disease or diabetes, like I went over earlier, which you or anything that you suspect is related to smoking, like the symptoms. And also, has smoking caused any problems at work or in your relationships? Like, how bad has this addiction actually gotten? Um, you can also go on the Mayo Clinic and find doctors and departments um, that you can just type it. I think you just type in your zip code and it will show you the specialists. So also the other resources I have, and like I said, I'll put this in a post, is obviously the Mayo Clinic. It's mayoclinic.org. You can check with your primary care physician, American Cancer Society, smokefree.gov, and the CDC, which is the Centers for Disease Control and Prevention. So now I put this on pause. What the hell? Okay, so I'm gonna show you a video, and it is by the CDC, the Center for Disease Control and Prevention, and uh, it it's going to help you to quit smoking. It explains how it affects the brain. It talks a little bit about nicotine replacement therapy and what you can do to help you quit smoking. So let me share this screen. Everybody see it okay? Can you see it?
No, I can't see anything.
Okay. How about now?
Yes, yes.
Okay.
Ever wondered what happens in your brain when you smoke a cigarette? Nicotine is an addictive drug that actually changes your brain. That's what can make quitting so hard. Nicotine reaches your brain fast. In less than 10 seconds, it travels from your lungs into the bloodstream and then into your brain. The brain is made up of many cells called neurons. Nicotine affects a pathway in the brain called the reward pathway. The reward pathway is a normal and important part to our survival. It's an area of the brain that makes us feel good when we do something we enjoy. Once nicotine arrives at this area of the brain, nicotine attaches itself to a receptor on neurons, like a key fitting in a lock, waking up the reward pathway of the brain. When the reward pathway is activated, a chemical called dopamine gets released and we feel warm and satisfied. However, too much repetitive stimulation of the reward system can be dangerous, especially with nicotine. Nicotine takes over the reward pathway, attaching to nicotine receptors to release dopamine, making the brain crave another cigarette. Every time we smoke, we get that feeling of reward, and so we do it more. This sets up an unhealthy pattern as nicotine tricks the brain into activating those feelings of enjoyment with every puff. This causes changes in the brain over time. The longer you smoke, the more and more nicotine receptors are created, and each one craves its nicotine fix. Over time, the body learns that it needs nicotine to feel good, but it can never get enough. That's why it's so hard to quit. The longer we smoke, the stronger the cravings for nicotine become. With no nicotine to bind to nicotine receptors, the reward pathway is not stimulated anymore. This means the brain releases less dopamine. With less dopamine, people can get withdrawal symptoms. The good news is that these changes in the brain start returning to normal the longer you go without a cigarette. Getting past the first stages of withdrawal when you quit can be hard, with lots of empty nicotine receptors screaming out for their fix. But the good news is that over time, there are fewer and fewer nicotine receptors as your brain goes back to the way it was before you smoked. While you are waiting for your brain to return to the way it was, there are scientifically proven ways you can help ease some of the withdrawal symptoms. One of these is nicotine replacement therapy, or NRT. NRT allows just enough nicotine to be in the body and bind to the nicotine receptors to keep many, but not all of them filled. This helps reduce the withdrawal symptoms you may feel when quitting smoking. NRT comes in two forms, long-acting and short-acting. NRT patches are long-acting. They keep a steady, low level of nicotine receptors filled for a long period of time to help make withdrawal symptoms like feeling cranky or restless more manageable. Short-acting NRT products include gum, lozenge, nasal spray, and inhaler. These get nicotine to the brain pretty fast, but the nicotine doesn't stay for very long. They can be helpful when you suddenly get a stronger craving. NRT weakens the cravings and retrains the brain to start losing its extra nicotine receptors. Using both long and short-acting forms of NRT together is more effective than using one type alone. Use the patch for that steady, low level of nicotine throughout the day, and then the gum, lozenge, spray, or inhaler for those moments when you have shorter, stronger cravings. Combining NRT with personalized help from a quitline coach or a healthcare professional can further increase the chances of quitting for good. Getting coaching can help you understand and change the behaviors that go along with your smoking. For help quitting smoking, including deciding which medicine is right for you, call 1-800-QUIT-NOW or visit cdc.gov/quit. Ever wondered what happens in your...
And then there was one last video that I wanted to show you. It's tips from a former smoker. Her name is Tiffany.
I started
Hold on, I gotta restart it.
taking walks. When I decided to quit smoking, I investigated several options that would help with the urges. And I felt like the nicotine patch would be the best option for me because it was something that was not visible and easy to use. I also picked a day that I would be really busy so that I wouldn't have the opportunity to smoke. I started taking walks, using my lungs for what they were meant to be used for, and just exercising my lungs instead of using them. Then also sharing my story with my daughter and letting her know that I had stopped smoking. I let another relative know that I had stopped smoking, and she would send me a text every day saying it's day 2 or it's day 3, and just encouraging me. And sometimes I would use the cigarettes in the restroom, and so I started drinking, water, because I was like, I'm not going to use that as a crutch. I was like, you know what, if it takes me 3-4 days to, be able to use a restroom without a cigarette, I'm doing it. But so I took the ashtray that I had out of my car, threw it away. I took my car, I had it detailed, so I wouldn't smell the smoke, because a car was like driving was a really big trigger for me as well. And so I knew if I got in my car and I smelled cigarette smoke, it was going to make me want one. I'm Tiffany, and I quit smoking, and so can you.
All right, guys, that concludes today's topic for nicotine addiction. I hope you guys learned something. I know I did. I always learn something when I'm researching these topics. Does anybody want to add anything before I turn the recording off? No? Okay, I'm gonna stop the recording. Not sure, I think maybe Colleen might help me out with a meeting next time. We gotta talk about it, so I don't really know what our meeting topic will be next time. But she was going to talk about things that we can replace our addiction with and how to recover without rehab, and when to know, and when to move on and how to move on. So look forward to that in the next meeting or so. Me and her will have to talk about that when we decide to do that. So thanks for watching. I'm going to turn the recording off and then we can talk.